The annual Medical Excellence Awards dinner was in full swing at the Ritz-Carlton. Crystal chandeliers cast a soft glow over Manhattan's medical elite as my parents, Doctors Robert and Diana Chin, held court at their usual table. I sat quietly at my assigned seat near the back, watching my mother gesture animatedly about their latest achievement, a potential merger between their prestigious Chin Medical Center and the larger St. Augustine's Hospital network. Emily's still running that little neighborhood clinic. I overheard my mother tell the chief of surgery from Mount Sinai. Such a waste of her education. We offered her a position at Chin Medical, but she insisted on playing small-town doctor. I sipped my water, thinking about my little clinic, Riverside Community Health. What my parents didn't know was that over the past 7 years, while they were focused on their luxury medical center's profits, I'd been building something far more significant. Did you hear about Emily's latest project? My younger brother Michael, their pride and joy, chimed in. She's trying to expand her clinic to serve more low-income patients. As if that's what medicine is about. My phone buzzed quietly, a message from Sandra, my chief of operations. Final paperwork complete. The network merger is ready. Should we proceed with tomorrow's board meeting? I smiled, thinking about the past few years. While my family thought I was wasting my potential, treating everyday patients, I'd been quietly building the largest network of community hospitals on the East Coast. Through strategic acquisitions and partnerships, Riverside had grown from 1 clinic to 37 facilities across 3 states. Most importantly, we'd recently acquired controlling interest in St. Augustine's Hospital network, the very system my parents were desperately trying to merge with. Speaking of the merger, my father stood, tapping his glass for attention. We have an exciting announcement. Chin Medical Center will soon join forces with St. Augustine's, creating the most exclusive medical network in the city. If the board approves it, muttered Dr. Thompson, an older surgeon who'd never quite fit into my parents' elite circle. He was one of the few who knew who really controlled St. Augustine's now. Oh, that's just a formality, my mother waved dismissively. The chairman would be foolish to reject such a prestigious partnership. My phone buzzed again. St. Augustine's board members are all confirmed for tomorrow's meeting. Press release drafted for your review. Emily, Michael called out, his voice carrying across the room, you should really consider coming back to real medicine. When the merger goes through, we'll need all hands on deck. I stood up slowly, smoothing my simple black dress. Actually, Michael, about that merger. Please, my mother interrupted, don't tell me you're going to lecture us about community access again. This is business, dear. Something your little clinic clearly hasn't taught you about. Dr. Chin, a voice called from the doorway. It was James Barrett, St. Augustine's CEO. The board chairman has arrived for your merger discussion. My parents straightened eagerly, looking toward the door. But Barrett walked straight to my table. Dr. Emily Chin, he nodded respectfully. The board is ready whenever you are. The silence that fell over the room was deafening. My mother's champagne glass slipped from her fingers, shattering against the floor. My father's face drained of color as realization dawned. Emily, he whispered. What have you done? I picked up my portfolio, the one containing details of every hospital and clinic in my network, including their precious Chin Medical Center's mounting debt that they'd hidden from their investors. Done. I smiled, remembering all the times they'd dismissed my vision for accessible healthcare. I built something a bit larger than a little clinic. Shall we discuss that merger now? The Ritz-Carlton's private conference room felt smaller than it was as my parents and Michael practically stumbled in after me, followed by James Barrett and several St. Augustine's board members. This is impossible, my mother kept saying, her perfect composure cracking. Riverside is just a community clinic. Was just a community clinic, I corrected, pulling up our network's data on the room's display screen. Now it's Riverside Health Network. 37 facilities, 15,000 employees, and the highest patient satisfaction rates in the region. But the money, Michael stammered, scrolling frantically through his phone. The resources needed to acquire St. Augustine's are considerable, I nodded. Fortunately, while you were focusing on luxury suites for wealthy patients, I was building a sustainable healthcare model that actually turns a profit while serving everyone. My phone buzzed, a message from Sandra. New England Medical Journal wants to feature your community health model. Also, the state health department approved all new clinic locations. Speaking of profits, I continued, pulling up another document, let's discuss Chin Medical Center's finances. Particularly those creative accounting practices you've been using to hide your losses. My father's face went even paler. How did you? Due diligence, Dad. When you apply for a merger, the acquiring company looks at everything. And I mean everything. James Barrett cleared his throat. Dr. Chin, Emily, is being modest. Riverside's model of combining high-quality care with community access has revolutionized healthcare delivery in the region. That's why the board appointed her as chairman. My mother sank into a chair, her hands shaking. All those board meetings we tried to arrange with St. Augustine's came straight to my desk, I finished. I particularly enjoyed your proposal to convert their community care units into premium spaces. Very characteristic of your priorities. Michael stood up, straightening his tie. This is absurd. Our medical center has been the most prestigious facility in the city for decades. Prestigious doesn't mean profitable, I replied, displaying more financial data. Or effective. Your patient outcomes have been declining for years, while your fees have skyrocketed. Meanwhile, Riverside's integrated care model. Stop, my father interrupted. Those numbers are confidential. Not from the board chairman of the company you're trying to merge with, I said quietly. Did you really think nobody would notice how you've been shifting resources from patient care to cosmetic upgrades? Barrett handed out folders to everyone. These are the terms Riverside is willing to offer. As you'll see, they're more than fair considering your current financial situation. My mother flipped through the pages, her face shifting from shock to outrage to resignation. You're not just acquiring us. You're completely restructuring our entire operation. Yes, I confirmed. Chin Medical Center will maintain its name, but its services will be integrated into our community care model. No more turning away patients who can't afford your premium fees. But our reputation, Michael protested, will improve, I cut in, when people see that quality healthcare can be accessible to everyone. Our network success proves it. My phone buzzed again, Governor requesting meeting about expanding the Riverside model statewide. Who representatives arriving next week to study the program. My father looked up from the documents, his voice heavy with realization. You built all this, while we thought you were just a small clinic doctor? I finished. Yes. Because unlike you, I believed healthcare should be about helping people, not just helping profits. The room fell silent as they continued reading through the merger terms. Their entire carefully constructed world of exclusive medical practice was about to change fundamentally. The press conference is scheduled for tomorrow morning, Barrett added. The headline Community Health Network Revolutionizes Cities' Healthcare is already written. My mother looked up, tears in her perfectly made-up eyes. Emily, why didn't you tell us? I stood by the window looking out at the city lights. Would you have listened? Or would you have dismissed it as another one of my idealistic projects? The next morning I stood in my real office, the top floor of Riverside Health Network's headquarters. The wall of windows offered a clear view of Chin Medical Center's building, its imposing facade somehow less impressive in the morning light. Dr. Chin, Sandra entered, tablet in hand. The press is assembled in the conference center. Your family is here for the final signing. I nodded, remembering how many times they'd made me wait outside their offices when I tried to discuss community healthcare initiatives. Send them in. They entered looking distinctly uncomfortable in my modern, efficient space, so different from their wood-paneled old-money medical offices. Gone were their usual condescending expressions, replaced by something that looked almost like embarrassment. Before we sign, I said, turning on the wall of screens, let's see what we've actually built at Riverside. Real-time data flowed across the displays. Patient care metrics, treatment outcomes, community health improvements. Every number told a story of lives changed, of healthcare transformed. Your preventive care program, Michael said quietly, studying the figures. It's reduced hospital readmissions by 60%. Yes, I confirmed. Turns out when you make regular healthcare accessible to everyone, they don't end up in emergency rooms as often. Amazing, isn't it? My phone buzzed, a message from the CDC, requesting nationwide implementation study of Riverside's community health model. Urgent meeting needed. My mother picked up our latest quarterly report, her hands trembling slightly. These patient satisfaction scores, they're higher than any luxury hospital in the country. Because we treat everyone with dignity, I explained. Not just the ones with premium insurance. Sandra entered again. Dr. Chin, the Community Health Advisory Board has arrived. They're waiting to meet the new integrated network leadership. My father looked up sharply. Community Health Advisory Board? Yes, I nodded. Real people from the communities we serve. They help ensure we're meeting actual needs, not just chasing prestige. They'll be part of Chin Medical's new governance structure too. I pressed a button and more data filled the screens. Lives saved, children vaccinated, chronic conditions managed, all at a fraction of traditional healthcare costs. This is what modern medicine looks like, I continued. Not marble lobbies and VIP suites, but real measurable impact on people's lives. Michael stood up, surprising everyone. Teach me, he said quietly. I want to understand how you did this. The model isn't complicated, I replied. We just put patients before profits. Everything else follows from that. My phone buzzed again. United Nations Health Division requesting consultation on implementing Riverside model in developing nations. Your brother's right, my father said, his voice heavy with realization. We've been doing it wrong all these years. Not wrong, I corrected. Just incomplete. Healthcare isn't just about treating patients, it's about healing communities. My mother dabbed at her eyes with a monogrammed handkerchief. All those times we called you a disappointment. Helped me prove that another way was possible, I finished. Sometimes being underestimated is the greatest advantage you can have. The doors opened as the Community Advisory Board members filed in, teachers, social workers, local leaders, and yes, some of my original clinic patients. The contrast between them and my family's usual crowd of wealthy hospital donors couldn't have been clearer. The new integrated network launches today, I said, picking up the final merger documents. You can fight it and lose everything, or embrace it and be part of something revolutionary. Your choice. One by one they signed. Even Michael managed a genuine smile. Well, he said, I guess my big sister knew best after all. As the press conference began downstairs, I caught my reflection in the window. No longer the small clinic doctor they'd dismissed, but the woman who'd transformed their elite medical center into something truly meaningful. Sometimes the greatest success isn't in proving others wrong, but in showing them a better way to be right. And as I took my place at the podium, I knew this was just the beginning of how we would change not just Chin Medical Center, but the very nature of healthcare itself. Standing there, facing the world's media, I was no longer Emily Chin, the family disappointment. I was Dr. Emily Chin, the woman who'd built a healthcare revolution while they weren't looking. And this was only the beginning.